The topic today we are going to talk about is hernia after C-section or cesarean section. And most of the women come to us saying, I did a cesarean section long back, many years back. Now I have some swelling pain. Or usually they go to the gynecologist and they get examined by the gynecologist. Then they say, okay, you have a hernia, you go to the surgeon. So we are today we are talking about hernia after cesarean section. Usually cesarean section is mainly for when the life of the baby or the mother is in danger. It's a unavoidable, inevitable surgery where they cut open the abdominal wall and uterus and deliver the baby, and they'll re-suture everything back. And most of the time it's done as a vertical incision, but nowadays the vertical incision stop, mostly the horizontal incision that is below the breast line. So most of the women, they don't even notice they have some hernia or swelling, anything. So after many years, most of the time the history is after many years or in a few months they find some swelling, pain, or constipation, and there are some discomfort, and you go to the gynecologist, the lady doctor, they examine, they find out it could be hernia, then they'll refer the patient to the surgeon. And like any other hernia, it has some reasons. In the previous videos we have talked about what is hernia, causes, how to diagnose, and the treatment options. Here the causes for hernia after C-section, usually it is called incisional hernia. We don't call a post-cesarean hernia and all. It's called incisional hernia because any cut or any operation after that, if hernia happens, it's called incisional hernia, and it's treated as an incisional hernia. So like any other hernia, it has certain reasons. Most of the time, when they get pregnant, the abdomen is distended, so the muscles, everything is stretched, so the muscles lose their tone, they lose their strength. The fascia loses mainly the fascia loses its strength. So when they cut and re-suture, it's a very weakest area. So always there is a chance for hernia to come. One. Second, most of the time, infection. Usually they give the history. After the cesarean section, I had a pus coming or fluid coming. The stitches are given way. So I took antibiotic for a long time. The doctor has to re-suture it second time also. So this is the history they always say. So it's all mainly because of infection. The third one is, suppose somebody is having diabetes or gestational diabetes, the temporary gestational diabetes during pregnancy alone, or naturally if you are diabetic, so chance of infection is very high. So and very importantly, the other reason is not following the doctor's instructions. Usually they say, don't do any heavy work or bending, avoid bending, weightlifting, don't avoid constipation. These things they could have given instruction, but after the pregnancy they may not have the time to think about all this, and they start doing all the things. They will be bending, they will be doing all the heavy work, So usually the sutures can give way. And the other reasons is because of the hormones. The hormones makes the muscles, fascia very thin and weak. So this can cause incisional hernia. And the other reasons, if you say most of the time they wear corset, or even they are very tight dress because they don't want the abdomen to distend. They think if you leave it just like that, they'll have a pot belly, so they put some dress or some material to tightly uneven, unduly tight dress, so that can give pressure, it can cause weakness of the muscles and cause hernia. So we always say don't do anything like that, but instead you can have a corset that also little firm, not tight. Always in the body, nothing should be tight or very you should not give tension to anything. So you can have a corset, uniform. It should be uniform and it should be firm, not tight one. So once the surgeon looks at the patient, he will clinically examine all the tests, scan, all those things. and it depends upon the site, and depends on the size. So you decide the treatment options, whether it's a surgical emergency. Sometimes the hernia they come present only with obstruction, so it's an emergency. It's a different way. Emergency usually with abdominal obstruction, usually it's open surgery. If they come in a elective surgery, then they will plan mostly all done by keyhole approach, laparoscopically with a mesh repair. The mesh is mainly it's a tension-free repair. Tension means you should not pull everything as a tight one and suture. That's why I told you abdomen corslet should be firm. The same way we keep the mesh. Simply we always say hernia, your shirt is torn and the inner things are coming out. The same way the muscles are torn and the internal structures, intestine, fat, everything comes out. So we put everything inside, close it with a patch of cloth. The same way, put a mesh and repair it. And follow the instructions or advice given by the surgeon for the next 3 to 6 months. Depends upon the age, depends upon your body weight. He will give some instruction, but mostly 3 months. Like you should wear an abdomen corset, should avoid constipation, avoid cough and cold, sitting on the floor or avoid doing any heavy work. These things should be avoided, and don't do anything that increases intra-abdominal pressure. Pushing and pulling, all these things, heavy work we should avoid, so that the hernia doesn't come back again. So hernia after C-section or cesarean is nothing but a hernia. Especially it's called incisional hernia, and it's a surgical condition. There is no medicine or no exercise or no yoga can cure that, and only the good option is, before getting complication, consult a doctor and get the proper treatment. Thank you.